What is the full form of ECG? No, electrocardiography. Electrocardiography. What is electrocardiography? What is electrocardiography? Electrocardiography is a method, a procedure, a technique by which we record. What we record? The electrical activity of the heart. Okay? So this is known as electrocardiography. But one problem is, electrical activity of the heart, electrical activity is generated in SA node, cardiac impulse is generated in SA node, it then travel throughout the heart. Okay, so it is there only. Then how can I record this electrical activity from my body surface, from my skin, from the surface of my body? Isn't it? Isn't it a valid question? How it is coming to my skin, my surface, body surface? So let's see how it comes. Go through this image. What is there? Only ventricle is there. We know SA node is here, right atrium. When it is generated, impulse is generated. This is the electrical activity. When it is generated, this electrical impulse will be transferred, will be spreading throughout the atrium. Okay? Suppose she is the SA node. She has generated the impulse. Okay? Now all these cells are syncytium. All are connected to each other. If it is stimulated, now this stimulated can be transferred to all the cells since they are connected to each other. Okay, so this impulse that is generated here will be transmitted to all these cells. How? First, its outside is positively charged, your outside is positive, your outside is positively charged. So when this impulse, current will be passing to these cells, it will be depolarized, means outside will be negative, inside will be positive. Then the current from here will be transferred to this, from heart to this heart, then from heart to heart. This way, this wave of depolarization will be spread throughout the right atrium as well as throughout the left atrium. Okay, but it cannot spread to ventricle this way. Why? Why can't spread? This impulse from atrial muscle cannot go into the ventricle in such fashion. In such fashion. Problem is, you are the ventricle, they are the auricle. In between there is a non-conducting tissue. What is this tissue? Atrioventricular junction. These are not made up of cardiac cells. They are made up of fibrous tissue, non-conductor of electricity. That's why this impulse is limited to the atrium only. But we know this impulse generated in SA node ultimately comes to the AV node. Ultimately comes to the AV node. Now from the AV node, the impulse comes to the ventricle. How it will be coming? Only AV node is having a wire. Only there, having a wire through which this impulse can pass. And while this impulse is entering into the AV node will do one thing. The rate at which the impulse travels to the AV node, the rate will fall. From AV node, transmission of this wave to the ventricle will fall. There will be a delay in AV junction. This is called junctional delay. In the bundle of His, in AV node, there is a delay. Purposefully it has been done. Otherwise, there would have been a lot of problems. What problem? Atrial blood enters into the ventricle. When atria contracts and ventricle relax, then only blood enters. Now both of you, if simultaneously contract, now where this atrial blood will go? Cannot enter. Because you are also squeezing, they are also squeezing, their blood cannot enter here. So, if their blood is to enter here, then at that time, ventricle has to be in resting state, relaxed state. So then only this blood can enter. So what has to be done? When you will be contracting, when you are conveying this impulse, that time AV node is getting, but AV node will not send this impulse to the ventricle, otherwise ventricle will contract simultaneously. So it is doing a delay there. So when it is completed, when atrial contraction is completed, then only ventricle contraction will start. So for this function, there should be a delay in the AV junction. And how this delay is made? Because here in the, I so told, in the there is a track. Here the fibers become very thin. Very thin. And we know electrical wire, which is thick, one wire is thick, another is very thin. Where the current flow will be more? In the thin or thick? In the thick. So, in the thin, since it has become thin, current flow will be less, there will be delay. Okay, so that's, by that mechanism, delay is done. Okay, so then only this, from AV node, current will enter into a bundle of His. Now, where this bundle of His, in between the ventricle there is a septum. This bundle of His will enter into the septum. That is the apical portion, and this is the base of the septum. So it will enter into the base of the septum. The base of the septum is near the atrium, and that part is near the apex. So here is the septum. Now this bundle will enter into the septum and divide into two parts. One part will go to the right side, another part will go to the left side. Left bundle branch, right bundle branch. Okay? But the left bundle branch is thicker than the right bundle branch. Again, who will get this side or that side, who will get first this impulse? Suppose this is the septum. This is the septum. Okay, so it is entering here, then bifurcating. One is coming to this side, another is coming to the, which one is thicker? Bundle, left side. So current first will, speed of current will be much higher here. So this surface will get impulse first. So their impulse will be, since they are getting fast, their impulse will be passing to this side. Before this impulse they are getting from this side, before that they are getting, these muscles are getting impulse from that side, since it is faster. Okay, so that's why the flow of current will be obliquely, not straight, obliquely, from right side to left side to right side, left side to right side. In this fashion, it will proceed to the apex. Okay, it will proceed to the apex. Now when it arrives in the apex, Purkinje fibers, here the speed of movement, transmission of this impulse is very fast, 4 meter per second. 4 meter per second, and there it was 1 meter per second. So it is very fast. Now this will spread along the wall, side wall, towards the base. So now you think, which part of the ventricle will be depolarized first? Septum, then the apex, then the base. Last, who will be the last? The base of the heart. Base means near the atrium. Okay, connectivity থাকলে কিন্তু ওইখান থেকেই পেয়ে যেত সবাই আগে atrium to ventricle. But it is not possible since there is a divider, and the divider is non-conducting. Okay, so in this way, and this is needed when we will be understanding the electrical axis of the heart. Otherwise, you will not. So you see how from right atrium means SA node. First, the all right atrial muscle will get, then the left atrial muscle will get, then it will come to SA node. From SA node, it will enter into the bundle of His, but here there will be delay. After the bundle of His bifurcates, left bundle branch, right bundle branch. So right side of the septum gets impulse later than the left side, cause I have explained. Then it will proceed toward the apex. From the apex, the impulse will spread throughout the ventricular wall towards the base. So this is the way how impulse spreads in the heart. So you have to remember this. A very good question comes. How SA node, how electrical impulse is generated in SA node? That means you have to explain the slow waves. I have already discussed slow waves. By slow waves, it is produced pacemaker potential. So it is having pacemaker. With this, it produces spike action potential, means cardiac impulse. Then it is spreaded through various junctional tissues and comes to the SA node, then to the AV node. From SA node it comes to the AV node. From AV node, this way to the apex, then to the base, towards the base of the. So this way you have to explain. Question, how it is transmitted. Now, we are coming to this. From SA node, from SA node, impulse has come to the, what is this? Septum. Now septum is depolarized gradually. Okay? And it is proceeding. Taking, this is the depolarization, this is the depolarized septum, means already cardiac impulse reached here. But this area didn't receive. Still the other area remain in polarized state, means outside positive, inside negative. But here, this because of depolarization, outside is negative, inside is positive. Now you see, right at this moment, it will be acting as a dipole. It will be acting as a dipole. Two poles is there. One is negatively charged, another pole is positively charged. When there is a dipole, there will be flow of current. So these are the flow of current. Current is flowing. Current is flowing. Now, another thing, this dipole, heart is now a dipole, like a battery. It is now a dipole. And this dipole is immersed in a volume conductor. Our body is a volume conductor. What does it mean? Conductor, volume. It is having something, and these are conductor. Means they conduct electricity. So, since heart is within a volume conductor, our body is having lot of fluids, and these fluids are having ions. So now electricity can move easily, means current flow easily. So that current which was generated here, it can be transferred to my skin also. Okay, so you can see the electrical activity of heart that is generated in the heart. Now they are transmitting into our body surface. Now I can pick up this current using a voltmeter, using a machine. This is nothing but galvanometer, improvised, amplified galvanometer. Okay. I put one electrode here, connected it to the negative terminal, and another electrode here, means one electrode here, means electrode here, and connected with the galvanometer. I can see there is a deflection in the galvanometer. Deflection in the galvanometer. Okay. Now, if this galvanometer, this deflection, this pointer may have a pen, so this movement can be recorded on a paper, isn't it? So this movement, this change in voltage difference between two regions can be recorded. This voltage difference can be recorded in galvanometer, in this machine, in a paper. So in a paper you will get this potential difference, and we know this condition is not fixed. This will travel again this way, again this way. Now the voltage will be different and this will be changing. So this deflection is always changing. And if we record this changing deflection on a paper, you will find different waves. And these are ECG waves. Is that okay? Right? Could you follow? So in this way you can record ECG waves. Now, how you will pick up this current? You have to pick up this current into this, and for this what you need? Different electrodes. So these are the electrodes, different wires. Lot of wires. Now, to record this electrical activity with these electrodes, we use a system called lead system, L-E-A-D, lead system. Okay? We call it lead system. Lead system, there will be two electrodes, one positive terminal and one negative terminal. Okay? So there are two kinds of lead system in our body we record. One is standard limb leads, another is precordial leads or unipolar leads. Okay, so we are bipolar leads, unipolar leads. First, leads are two types: bipolar leads, unipolar leads. Bipolar means there should be two poles, means two electrodes. One should be negative, one should be positive. Okay. Let me see. What is the difference of voltage between this hand and this hand? So I have to place one electrode here, another electrode here. Now where to place the positive electrode? Here or there? Here in this case, if you place this, instead of you place it here and you place it here, deflection will be at that side. So this is important. The wave, you will get a positive wave here, but if you reverse the connection, it will be downward. So it is important where to place the positive. So we will place the positive electrode. For bipolar leads are three types. How many? Bipolar leads? Three types. and these are called standard limb leads. Standard limb leads. Okay? That means this bipolar lead will be using the limbs. Which limbs? Left hand, right hand and left leg. Okay? So let us, we have three lead system. Lead 1, lead 2, lead 3. Now this is lead 1. Connecting this and that. Where should be the positive pole? Here, left hand. So in lead 1, this is positive, positive. Okay? So definitely there will be a positive wave. And it may vary. When current will be flowing to opposite direction, then it may be produce negative wave. Okay, it will depend. So P, Q, R is some are positive, some are negative. We will find. So this is where is the positive pole? Where? Left hand. Negative pole, and this is lead 1. Now the lead 2. This hand and this leg. Positive pole here in the leg, not here. So it is always negative. In lead 1 it was negative, in lead 2 it was negative. Can you remember this? This right hand is always negative for lead 1 as well as for lead 2. Okay, so automatically if it is always negative, so they will be having positive terminal. And lead 3 from left leg to left hand. Here again positive there. That means my left leg is always positive. Can you remember this? Will you remember this? Okay. So these are the 3 standard limb leads. Could you follow? Correct? Now we'll discuss about the unipolar limb leads. Now we'll correct the unipolar limb leads. Unipolar limb leads are two types. One is augmented limb lead, another is precordial leads, means chest leads. Then unipolar limb leads, two types. Augmented limb leads, again limb is coming, that means it's special type of leads. These are augmented, again we will be using the limbs. And chest lead or precordial leads means around the heart. These are the chest leads. Now let's see what are augmented leads. Unipolar. I said that these are unipolar. How it can be unipolar? One thing there will be one positive electrode. For limb 1, for this lead, there will be a positive electrode, positive one. So it is having a negative one. This negative electrode, keep it. You hold it. Hold this negative way. Okay? Again, for this, there should be positive and negative terminal. So hello, keep it. She got 2 terminal, negative terminal. And for this, again, a positive pole is a negative, hello, keep it. So she is holding 3 negative terminals, and here the voltage is 0. When these are united, this is 0. So others are positive. So I am checking the voltage, electrical activity against a 0 voltage. Against a 0 voltage in reference to a 0 voltage. Could you follow this? Very simple. Okay. Now what I will do? For in case of ABL, positive electrode here and all the 3 electrodes are there. So what is the change? Let's see what is the change. So this is ABL. Now positive pole is here and other 3 are combined. Now it is ABR. And if I keep the positive pole there and compare it 0 voltage, then we will get ABL. Here a special type of resistance is used. That's why it is to augment the morphology of the size of the waves. This is why it is called augmented limb leads. Augmented limb lead. This is one kind of unipolar leads. Okay. One more thing. Or we can assume. Think of a triangle. What type of triangle? Equilateral triangle. Very good. I think you are studying ECG. Equilateral triangle. Okay. Connecting two limbs is one side, and this limb and this is another side, and this limb to this limb another side. Okay, I'll make it easier. The root of this limb is here, acromion process, and root of this hand is this here, and root of this is the pelvic bone here, or right inguinal canal here. So now I can connect all these three, and there will be a equilateral triangle. And one thing you will observe, at the center of this equilateral triangle, who is there? Your heart. Your heart is there. So you are studying your heart from this. So when we will be discussing about the electrical axis of the heart, the vector of the heart, this is important. So this, if question comes, will come. What is this? What is Einthoven's triangle? And what is Einthoven law? Will come later into Einthoven triangle. When we will be coming to how to measure the vector and a vectorial analysis, then I will tell you what is Einthoven. But this is the Einthoven triangle. Okay? So we came to know Einthoven triangle. But one thing yet left. What is this? Precordial leads. Precordial leads are also unipolar leads. Here also all negative poles are together. Only thing, positive pole is, it will be, the positive pole is exploring. It will be exploring. It is the exploring electrode. It will explore my heart from different position. And other electrodes are fixed at particular point. Okay? So this is the exploring electrode, and other one is fixed or reference electrode or indifferent electrode. Okay? So now this exploring electrode, where to place them? Because I have to see the heart from anteriorly, laterally, posteriorly, what is happening in the septum. So that's why I have to see the heart from different sides. Okay, so for that purpose, we have chosen 6 sides, 6 positions. How many? 6. Okay, now right at the left, niche, B1, B2, B3, B4, B5 and V6. Okay, so these are the 3 precordial leads, 6 precordial leads or 6 chest leads. Precordial leads, chest leads, all the same. So these are the 6. In some cases, we can take 12. So that means we have to go back a little bit. But it is not. This is sufficient. We actually perform 12 lead electrocardiogram. 3 standard, 3 augmented, 6 and plus this 6, total 12 lead electrocardiogram. Is it right? Okay. So now let us see the positions of positive electrode in case of B1. Where to place this? First, you consider your right side. Right side. And there you will be having a border, right sternal border, from where fourth intercostal space begins. So you can identify the space 1, 2, 3, 4, fourth intercostal space. And what is the position? Here, here, or here? Sternal border. This is the sternal meropeum at the border. So from the border means from where this space begins. So this is the place for B1. And B2 will be just opposite to this. Then what you will write? Left side, left sternal border, fourth intercostal space. One is right side, the left side. And position is fourth intercostal space at the sternal border. Now, I will not tell about lead 3. I forgot to tell. I forgot. Where to, I don't know. And lead 4. Lead 4, where the space? It is the fifth intercostal space. And this is the clavicle. And this is the mid position. Now think a line vertically. So this will be crossing the fifth intercostal space. That is the point of B4. That is the point of B4. Now I have to locate the position of B3, which I said I don't know. So B3 is just in between B2 and B4. So this is B4 and this is B2. So think of a line connecting these two positions. At the center you place the B3. Clear? So B4, follow. Now another two positions are left. One is B5 and another B6. What is the position of B5? The position of B5 is fifth same intercostal space, but here this is my axilla. This axilla is having three borders. This is the anterior border, this is the posterior border, and this is the midline. So you think the anterior border and think of a vertical line from this anterior axillary. This is the anterior axillary line, and this line will be crossing the fifth intercostal space. That is the position of B5. And this mid axillary line will be crossing the same fifth intercostal space, and that will be the position of the B6. Is that clear to you? B1. B1. Right side, right sternal border, fourth intercostal space. Right side, right sternal border, fourth intercostal space. Opposite to B2. Is that clear? Lead system you understood? Any doubt about the lead system? Question may come. What are the limb system? What are the different type of limb system? Explain. Okay. We learned ECG is electrocardiography, procedure, technique, methods. Then, what is this called? This machine? The method uses a machine. What is the name of this machine? Somebody says electrocardiogram. Is that okay? Wrong. It is electrocardiograph. Don't confuse with a graph paper. It is electrocardiograph. And electrocardiogram, it is a record this machine will produce. And this record is called electrocardiogram. So this is the difference between electrocardiograph and electrocardiogram. What is electrocardiography? Electrocardiogram, electrocardiogram. Now, let us see. Whatever the leads are, it will produce some waves. These waves are PQRST. This PQRST, some waves are positive, some are negative. How will it determine which side is positive, which side is negative? There should be a baseline, zero line. Zero line means zero voltage. If any fluctuation, if any wave is above the baseline, it is positive wave. If it is below the baseline, then it is the negative wave. Okay? How can you get this baseline? Before P wave, there will be a straight line. And after T wave, there will be another baseline. And other baseline you can't see. So you connect it. This is the baseline. Now you think which is above the baseline? So in that way you can determine whether a wave is positive or wave is negative. And one more funny thing is, and we'll explain, in some leads, some waves that I have seen it positive, and in some way it is negative. It is inverted. We call it inverted. Which was positive, now it is inverted in some leads. When we'll be discussing about different waves, then in which leads they become negative, biphasic. Both component, positive as well as negative component is there. So biphasic, some wave may be biphasic. Some wave may be flattened. Flat, isoelectric. No positivity, no. Depending on the leads. In some leads, it may appear like this. When we will be analyzing different waves and the time taken for different wave, we will find in ECG we determine different durations, different intervals, different segments. All are time. All are time. Duration, time. Interval, time. Segment, time. All represent are by time. So what is the difference between these? Let us see. Again there will be P, Q, R, S, T in this way. Okay? This is R wave, this is R wave, this is S wave, this is Q wave, this is P wave, this is T wave. P, Q, R, S, T. Now see, this wave is a positive wave, this is the baseline. Over the baseline, so it's a positive wave. And its duration is this. Sir, how we will calculate the duration? And this fluctuation is voltage. How I will determine, sir, what is the voltage of this wave? I will do it. Okay, let us understand. सबको दिखाओ. From this paper, we will determine the amplitude of a wave, that is, what is the millivolt, what is the voltage of this wave, and how much time it required. From this paper only. He is having two axes. We know graph paper has two axes. One is X. Which axis will represent time? Because this paper will be moving like this. This x-axis will be our time. And this paper, hello? And this paper moves at a speed of 25 millimeter per second. 25 millimeter per second. The 1 millimeter will tell us corresponds to certain amount of time. What is this time? 25 millimeter per second. This is the paper speed. That is 1 millimeter means how many time? This 1 milliliter. In axis is 1 millimeter. What is the time? Exactly. How you can give this value? 1 by 24. 1 second by 24 is 0.04 only. So one small division, 1 millimeter is equal to 0.04 second. Now, if you find these two wave, beginning of this, end of it, taken 2.5 millimeter. 2.5 millimeter. What would be the time of duration of P wave? 0.04 into 2.5 means 0.1 second. Means 0.1 second. So this way you can determine duration of this wave. Duration of this wave. What is this QRS complex? From starting of Q to end of S. This is the QRS duration. And this is the P duration. T, beginning of T, end of T. This is T duration. Now amplitude. In the machine, one button is there, 1 millivolt. So if the paper is moving at the same speed, and if you press 1 millivolt, it will produce a deflection. How much? It will produce 10 millimeter. That is, 1 millivolt means 10 millimeter. 1 millimeter, if a wave is 2 millimeter, suppose P wave, it is amplitude is 2 millimeter, then what would be the voltage? 0.2 millivolt. If an R wave is 12 millimeter, then 1.2. Okay, to 1.2 millimeter. In this way, you can, from this, this will be recorded on this paper. So, from this paper, you can determine the amplitude of different waves and the time of different waves. Understood? Next, what are different duration I got? This is one duration, this is another duration, and this duration. Okay? Another is interval. What is interval? Interval means within interval time, which will contain a duration also. Which will also contain a duration. Suppose QT interval, starting from Q and end of T. So this is called QT interval. So within this QT interval, QRS duration is there, T duration is there, plus another time is there. Okay, so that's why these are called interval. Okay, so always whenever this term comes, this way it will contain some duration also. Okay, so QT interval, what does it mean, this QT interval? This is what ventricular depolarization. When the ventricle is totally depolarized, then it will produce Q, R and S wave. Q is represented by septal depolarization. Depolarization of the septum. And this part is ventricular depolarization, and T is represent the ventricular repolarization. So this is depolarization and this is depolarization. And from here to here, it will represent the ventricular depolarization as well as the repolarization. Okay, so how much time it took the ventricle for depolarization and repolarization. This is the time it took during for depolarization as well as repolarization. Actually, during depolarization, ventricular muscle contract. And the latter part, during repolarization, ventricle relaxes. Okay, so that you have to remember. Okay, now you got this interval. Another is RR interval. RR, not RRR. So RR interval means this peak to this peak. So the time duration you can easily calculate. Okay. From this we determine the heart rate. From this RR interval we immediately can determine the heart rate. What is that time? Divide 1500 by this time, number of millimeter. How many millimeters are there? Peak, and divide it by divide 1500 by this. You will get the heart rate. Very simple. Other ways there I will tell you. When you will be making report, that time inspect immediately you can say what will be the heart rate. So this interval, RR interval, is for what? Measuring heart rate. Another thing we also use for RR to see whether the heart is beating, ventricle is beating rhythmically, means in the same time interval. In normal individual, during inspiration, heart is beating, heart rate will be high. While exhaling, heart rate will be less. This is called arrhythmia. What type of arrhythmia? Sinus respiratory arrhythmia or respiratory sinus arrhythmia. Okay, the fluctuation that we see in heart rate during breathing. Okay, the reason is there, we will explain the reason, why it happens. Okay, so this is about another 3 minutes I am having. So this is about what? This interval. Another very important part of ECG, whenever do a ECG, immediately we go into this segment. Let's see what is there. When a patient is giving a sign symptom of chest pain, immediately we think of what? Whether the patient is having myocardial ischemia or he is having myocardial infarction. So this will be reflected here. This is the ST segment. End of S, beginning of T. So this is very sensitive segment which reflects the myocardial metabolism. If myocardium finds less oxygen, it will be depressed. The ST segment will be depressed. How? What kind of? How it will be depressed? Like this. Below the stress, below the baseline. We have to see how much. What is the distance? How much it is below? So, with that, we confirm this ischemia is there. At the same time, and in case of infarction, there will be elevation, not depression. There will be elevation. This sort of elevation will be there. ST segment is elevated in infarction. Not only this T wave will also be changed. This T wave will also be, it may be biphasic, it may be small. So it may, the T wave, nature of the T wave also may be. We'll discuss when we'll be discussing about myocardial infarction and the ECG changes. Okay, so these are the very important segment. So first we will go into this. If the patient is, or normally whether the origin of heartbeat is from ISA node, so there will be regular P wave. So it means it is sinus rhythm. So from impulse is generating from the SA node. Okay, so this is the sinus rhythm. Okay, so from ECG, if you find P wave followed by QRS wave, every P wave is followed by QRS wave, then it is sinus rhythm. If you find P wave, again another one QRS wave missing, P wave, again P wave, QRS wave not missing, again P wave, then QRS wave. This is block. This is heart block. Blockage of transmission of waves. There are transmission of impulse from SA node to AV node. Okay, if you find PRO, another important segment, this part, this segment means from here to here, beginning of P and beginning of Q. This is important. If you find in the first wave, P wave is this mass and its maximum limit is there, 0.2 second, not more than this. If it is more than it is pathological. So if you increase, if in one beat it is this mass, in the next beat it has increased, in the next beat this is first degree heavy block. And if you find P wave, 3 P wave subsequent, then 1 P wave followed by QRS, that is 3:1 heavy block, 2:1 heavy block, 2 P wave, then third P wave followed by QRS wave, that is 2:1 heart block. Okay, in case of heart hypertrophy of the heart, again the R and S wave, it may change, T wave may change, ST segment may change. So these will be changed during ventricular enlargement. We will explain in left ventricular hypertrophy, in right ventricular hypertrophy what happens. Another last thing, the P wave, since it represents the depolarization of the atrium. So this is the only wave that is represented by the atrium. Atria can undergo enlargement. Right atria can undergo enlargement. Left atria can undergo enlargement. Both can undergo enlargement. How can you identify? Normally, this P wave is, limit is this, up to this mass, and upside, the top side is rounded. But if we find height is increased and the top is tent shape, then it is, Are Baba, the patient is having right atrial hypertrophy. Right atrium is enlarged. Okay, if we get P wave as M shape, M shape, that means both the atria are enlarged. So normally it is like this, but if it is tent shape or it is M shape, it will signify that either the atrium is hypertrophy, enlargement is there, or both the atrium, or single atrium, or both the atrium. Okay. Beside, these waves also show changes during blood levels of hyperkalemia. When blood levels of these ions are changed, then it will also reflect the T wave, it will reflect the P wave also. So we'll discuss in later. So this is the initial part. So here what you have to now study, you make a note, what are the different waves, what is their normal amplitude, what is their normal interval, what is the clinical significance of this. Okay, clinical significance of P wave, clinical significance of QRS wave, when PR interval is increased. So in this way you learn from there.